So the general trend is going down. We've had a couple new cases going around town. Do you want to talk about those at all?
Yes, we just have. So while our overall cases the past couple weeks were better, since that data was tabulated, we do now have an outbreak amongst staff at Casey's Pond, our local skilled care facility in particular, in that section. We are waiting on other test results to come back. And at the time that you and I are having this conversation, we don't have any residents who have tested positive. But this is certainly a concerning event. We've seen this happen in our county twice before. So back in the spring, after our first wave of cases, we saw an outbreak at Casey's Pond. Here in July, when we had a second significant kind of surge or wave of cases, if you will, we ended up with an outbreak at the Haven, which is the assisted living facility over in Hayden. Here in the past month, end of September and into October, we saw another surge of cases, presumably related to the Labor Day weekend to some degree. And here we are again with another outbreak amongst one of our vulnerable populations. I would suggest that there is a relation to that. When the prevalence of disease in our community gets bigger, it just means it's more likely that especially our vulnerable community members are at risk of contracting it, and not necessarily through any fault of their own. And I think this point highlights that even though many individuals personally have a low risk if they get COVID-19, it isn't only about them. If individuals, even though they're doing okay, get COVID-19 and we increase the presence of it in our community and therefore the risk of spreading it, that increases the risk to the people with whom we live and care for in our community. And that includes vulnerable populations such as our older residents and invalided residents at some of our skilled care facilities and assisted living facilities.
Casey's Pond, we've beat this before. Let's do it again.
Yep, that's exactly the attitude. They've got the knowledge and ability, and they were successful before. They're going to be successful again in containing this and getting rid of the outbreak over there. And I would highlight at the time of you and I are talking here, so far we only have positive cases among staff, not residents. And this only involves the Doak House, which is our skilled nursing component at Casey's Pond.
And so I'm assuming all those 5 staff are going into self-isolation?
Yes. Yep. They've all been in, already started that process. And Casey's Pond does weekly tests of all their staff. That's actually how they found this. None of these staff members were positive, but their own measures of screening for it in their population were effective in finding these positive staff members. And so they have we've kind of got a good process that we certainly learned before that gets employed with now extra use of PPE equipment. We have conversations with contacts at the state public health department and these individuals focus just on outbreaks at skilled care facilities. So we're trying to bring to bear all the knowledge and resources that we can to stop the spread of this any further.
Well, Dr. Harrington, thank you for all this information. Thank you again for joining us on air and sharing with the community here in Rowan County the latest COVID updates. So thank you so much.
Yep, always great to have the opportunity to speak with you, and have a good week.